Periodic inspection and testing of the LifePak 12 defibrillator monitor helps to ensure that the defibrillator is ready for use at all times. An operator's checklist is provided in the operating instruction manual. It is a suggested checklist to inspect and test the defibrillator. It may be photocopied for your use. This checklist is not a replacement for preventive maintenance tests, which should be performed regularly by qualified service personnel. The patient's ECG can be monitored with a 3-lead, 12-lead, or 5-wire cable. This is referred to as ECG leads monitoring. The ECG can also be monitored with standard or hard paddles, or the quick combo therapy cable and electrodes. This is referred to as paddles lead monitoring. The LifePak 12 defibrillator monitor screen can display up to 3 waveforms. The top waveform area is called Channel 1, the middle area is Channel 2, and the lower area is Channel 3. The ECG always displays in the top channel when the defibrillator is on. Channel 2 may be left blank or display a continuation of the Channel 1 ECG or one of the other monitoring parameters or a trend graph. Channel 3 is available only if a 100mm printer is installed. It may be left blank or display a different waveform or a trend graph. Consult the operating instructions for more information about using channels 2 and 3. When the 3-lead cable is connected, only 3 limb leads, 1, 2, and 3, can be selected for ECG monitoring. When the 5-wire cable is connected, the 6 standard limb leads can be selected for ECG monitoring. In addition, the 5th wire can be placed in any of the chest lead positions. When the 12-lead cable is used, the standard limb and precordial leads are available. Only the 12-lead ECG cable will be demonstrated in this video. The 12-lead cable has 3 parts: the main cable that plugs into the monitor, the limb lead attachment that plugs into the main cable, and the precordial lead attachment that also connects to the main cable. The precordial lead attachment is not required for basic ECG monitoring. It is used for precordial lead monitoring or to obtain a 12-lead ECG, which is covered later in this video. To monitor the patient's ECG, press on. Adjust screen contrast if necessary. Connect the ECG cable to the monitor if not already connected. For the best signal quality, prep the ECG electrode sites by cleaning the skin with an alcohol pad, followed by a brisk rub. Shave the electrode sites if necessary. Confirm that the electrode's expiration date is not passed, and attach an electrode to each of the lead wires. Remove the electrode from the carrier and check that the gel is intact. Holding the electrode taut with both hands, apply the electrode flat to the skin. Avoid pressing the center of the electrode. Place the white right arm electrode on the patient's upper right chest below the clavicle. Place the black left arm electrode on the upper left chest below the clavicle. Place the green right leg electrode on the lower right chest, and place the red left leg electrode on the lower left chest. Secure the cable with the clasp to prevent tension on the electrodes. Check that the ECG is displayed on the screen. If the power on default is lead 2, the patient's ECG and the indicator 2 are displayed. If the power on default for the ECG is paddles lead, the screen displays a dashed line and the lead indicated is paddles. To change to lead 2 or any other lead, press the lead button. The ECG lead menu appears and the lead automatically changes to lead 2. If another lead is desired, continue to press the lead button or rotate the selector. After a few seconds, the menu disappears, or you can press the home screen button. Alternatively, you can use the selector to highlight channel 1 and change the lead. Check that the ECG size is adequate for heart rate counting. If the ECG size is too small or too big, heart rate counting may be inaccurate. The heart symbol should flash, and the systole tone should sound once with each QRS. To adjust the systole tone volume, highlight the heart rate area, press the selector to display the heart rate menu, press the selector to black highlight QRS volume, then rotate the selector to increase or decrease the systole tone volume. If the heart rate counting is inaccurate, adjust the ECG size. Press the size button. The size menu appears. Continue to press the size button or rotate the selector to change the size. Note that the ECG trace in channel 1 automatically changes as each size is selected. To monitor the ECG in Paddle's lead with the quick combo therapy cable, press on, adjust screen contrast if necessary, connect the therapy cable to the monitor if not already connected. Wipe clean and dry the patient's skin, shave or clip excessive hair, and avoid placing electrodes over broken skin. Do not use alcohol, tincture of benzoin, or antiperspirant to prep the skin. Check that the therapy electrode's expiration date is not passed. To prevent drying out of the electrodes, open the package and remove the backing only immediately prior to use. After removing the backing from the electrode, apply the electrodes on the patient's chest in the anterior lateral position. The electrode with heart symbol is placed lateral to the patient's left nipple in the mid-axillary line. The other electrode is placed to the right of the sternum below the clavicle. Press the electrodes firmly from one end to another to prevent entrapment of air. Connect the electrodes to the therapy cable. Check that the ECG is displayed on the screen. If the power on default for the ECG is lead 2, select Paddle's lead. As previously described, check the ECG size and that heart rate counting is correct. The most common problem encountered with ECG monitoring is poor ECG signal quality. High frequency or 60-cycle interference may be caused by equipment connected to the patient that is improperly grounded. This may be temporarily corrected by operating the other equipment on battery power or unplugging unnecessary equipment. Baseline wander may be due to the patient's breathing. This may be corrected by repositioning the ECG electrodes to an area with less movement. Two other reasons for poor ECG quality are using outdated electrodes and inadequate skin prep. Always use fresh electrodes and prep the skin as previously described. The frequency response of the monitor screen is intended only for basic ECG rhythm identification. It does not provide the resolution required for diagnostic or ST segment interpretation. For diagnostic, ST interpretation, or to enhance internal pacemaker pulses, attach the ECG cable and print the ECG in diagnostic mode or obtain a 12-lead ECG. This concludes the ECG monitoring section of this video.